All right, good morning, everyone. Welcome to the county EMA briefing on the Johnson & Johnson vaccine. I appreciate everyone taking time out of their busy schedules to attend this briefing. Everyone has been muted upon entry, so if you have any questions, you can enter them into the chat function on the WebEx. So with that, I will go to Director Padfield.
Good morning, everyone. As we work through the advancing the slide issue here, I'll kind of give a overview. So again, thanks for hopping on at short notice. So many of you, some of the information is already out there, so many of you are probably reading bits and pieces of this. And the use of the Johnson & Johnson vaccine that has just recently been approved by the FDA. And the educator initiative to be able to start to reopen schools and also to get kids back into the classroom. So a couple of things with this. This is obviously rapidly evolving. We know that J&J was approved. It was able to be ordered this week by the Department of Health. And there was a lot of discussion at the governor's level, and the legislative task force formed to be able to take a look at vaccine administration across the state. there was a consensus among that group that this should be used, and we'll go back to kind of why, the thought process was kind of centered around this. But the consensus was that it should be used potentially in the educator space to be able to essentially restart the economy, get kids back into school, specifically centered on the K through, like 3 right now, or 4, depending on what you're looking at, because they're the most vulnerable to learning loss at this point in time, but also to help with the economic recovery as well. A couple of, the thought process around that, a couple of considerations was the fact that this was going to come out and the state was allocated 94,600 doses, or just shy of 95,000 doses. And then the allocation for the state was going to go to 0, or most likely go to 0 for the following 2 to 3 weeks before there was another allocation of J&J. So as everybody's aware, this was released as a single shot. This was released as a, so we get this. All right, we should be better now. All right, and again, if you join after the fact, we're working on getting you muted so there's no feedback. So because this was coming out in a slug initially of 94,600 doses, when they looked at the education statistics across the state, it looked like there was going to be good coverage, especially for the early childhood educators and the elementary space. So the decision was made to be able to use this vaccine in that fashion and to be able to roll it out as fast as possible, and also use an independent delivery system that we'll brief on here in a little bit, so that it does not become a significant impediment to the current delivery system in the way that Pfizer and Moderna is being delivered across the state. So this is kind of a unique opportunity to be able to do this. And to be able to rapidly get children back into school as fast as possible. Understanding, though, also that it is not a requirement to be able to get children back in school. The CDC has come out with obviously supporting information regarding that. However, this helps significantly, and it aligns with the current administration, the federal administration's push to be able to reopen schools and get children back into the learning environment. So we'll talk about, what the operation is going to look like. This really went from concept to operational planning over the weekend, and required a lot of work with Department of Education and Department of Health on this, and our agency, to really take a look at operationalizing this plan in very short order. We understand that, there are probably a lot of questions out there regarding, why this option was chosen and those types of things. Ultimately, that is the decision of and the guidance of the legislative task force. The governor is going to have a press conference at 11 o'clock today to kind of talk the high-level overview, and then Department of Education, Department of Health, and our agency will have a press conference tomorrow to brief more on the detailed plan. And we'll talk about how we're leveraging the National Guard and a contractor to be able to do this, and a little bit about the plan right now from an operational perspective. With that, I'll turn it over to Tim to take it.
Okay, great. Thanks, Director. So just a couple of things on the concept of operations we can go over with the folks now. And like I said, some of this is still being refined. As the Director had mentioned, we brought on board a contractor that's doing some rapid hire of staff and finalizing plans. But the concept of operations will be that we'll establish vaccine sites, closed vaccine sites, within the 28 intermediate units. And this will be done near simultaneously between the 10th and the 13th of March. And the reason we say near simultaneously is not all 28 will probably get stood up, on the 10th. It'll be a flexible window where some get stood up on the 10th, some on the 11th, some on the 12th, some on the 13th, and so on. But generally by the 14th or so, all 28 should be up and running. And then as doses administered, depends on throughput of the site, how many folks need vaccinated and such, then they'll also stand back down to to where we are completed with vaccinating everyone in this first round for 94,600 vaccines by close of business on the 22nd of March. And there again, because of the way we're ramping up and ramping down, some of the sites may be done before then, but that's the operational window. The majority of the sites are going to be in the 250 to 500 per day range, so somewhat around that type 4 range, but some will be larger, potentially up to the 1,000 a day range in some of the larger intermediate units. Some of the rural intermediate units, because of drive times and accessibility, and we looked at 3 in particular with 8, 9, and 17, may also have mobile teams where they'll go to a location, spend a couple of days there, then go to another location, spend a couple of days there to reduce drive time and those types of things. And as the director had mentioned, you know, the first round of vaccine is at 94,600, and there will be additional vaccine coming. We just don't necessarily know how much we're going to get and when we're going to get it. But once we have this network essentially stood up of these sites across the 28 IUs, after the 22nd, as we get additional vaccine, we'll stand up these exact same sites again to vaccine the next highest priority teachers and administrators and whatnot until we get through all of the folks that are eligible within this program, which are generally the educators, the administrators, and support staff that work within the schools. It does include the public schools as well as the private parochial type of schools as well. So as was mentioned, we do have AMI as our primary contractor for this initiative, and they are currently working on their resource staffing, getting all the folks on board they need to get on board, orientation training, all this and that. We'll be using the state's system, PrepMod, for doing the registration and scheduling there. Again, it's a closed environment, so it makes that a little bit more manageable. But DOH will be partnering with AMI for the resources to be able to do the registration and all those types of things. We are going to be using the National Guard to support sites. Probably not all sites will have National Guard folks at them. They will have clinical and non-clinical staff, but like I said, the primary force provider will be AMI and augmented with some National Guard folks. There were questions that came up with the IUs. The National Guard will be in uniform, and they certainly won't be armed. Their mission is to give vaccines and support vaccination. We don't anticipate any issues with security and those types of things. PEMA and DOH will also have staff on each of the locations. So there'll either be a PEMA person as a liaison at each site working with the site administrator and the point of contact from the facility, or it would be a DHS person maybe from their EP shops or something similar to that. Or we also have BCHS folks that will be involved in this operation that will also be working with the actual vaccine, moving it around, being on site, managing cold chain, those types of things. As far as the intermediate units, we've already spoken with the 28 IU executive directors, and essentially what we've asked them to provide, besides the names of the staff and whatnot that are going to get vaccinated, is that they're going to provide the facility. It could be their IU building, it could be one of their schools, but it'll be their facility and the facility POC, and then any general support that they think would be necessary to help set up tables and chairs, unlock the building, those types of things. The list of facilities is currently being gathered, and as we get it, the AMI folks are reaching out to the facility POC just to ensure that that facility will work for the throughput that's anticipated for that site. And this is just, if you're not familiar with the 28 intermediate units, this is just an overlay of the 28 IUs across the county maps. And there again, with the exception of the city of Philadelphia, we'll have teams that'll work in all of the intermediate units as of today, or as we move through the plan. So as far as the county emergency manager's role and whatnot in this, so the state, which is between PEMA and the Department of Education and the Department of Health, and we're using some other state agencies, obviously, will be responsible to provide all of the required staff. And the required staff is laid out, if you're familiar with some of the type models, that's really what we're looking at, although the AMI model is slightly different than that. But this is all the clinical folks, so this is medical direction, this is the folks that administer the vaccine, these are the people that will do the post-vaccination monitoring, the pre-screening, you know, to make sure they're in good shape to get the vaccine, the actual administrative registering within the systems, you know, doing all that stuff. Also working with the Department of Health on the cold chain management, you know, all that stuff, the red bag waste disposal, right? All that stuff will be taken care of at the state level. The IUs did ask, some of them asked, I should say, that if they wanted to have some additional support staff there, could they? And this would be folks like greeters, folks to escort and point people in the right direction. Also, a lot of them asked, you know, would be okay if their school nurse was on the scene. And they will be there if they want to be. They just wouldn't be in a clinical role. There again, you know, all the clinical aspects will be covered by AMI and under the AMI medical directors. But there could be other people there. And then, you know, the IUs may also contact the county emergency management agency, especially if they have an existing relationship, because some of the IUs did mention, you know, the existing relationship that they had with their county emergency management agency. You know, for non-required, not non-non, but non-required support that they feel that they may want. And this could be something as simple as traffic control or something similar to that. But like I said, the actual conduct of the site, the administration of vaccine, the normal wraparound that would be required for that, you know, outside of the facility and, you know, facility POC to unlock the doors and make sure heat's on and, you know, provide those normal things that a facility POC would provide. The rest is being provided for all the required stuff from the state through the AMI contractor or through state agencies. There again, once we refine the list of locations, so we do intend to work with the individual counties on a one-on-one basis to provide the location, the hours of operation, and the dates of operation once we have all this confirmed. That way, you know, you all have good essay on, you know, that site and what's going on there. And this will be similar to how I worked it with the counties when we established the DHS sites for the group homes and stuff like that, where you'll be given that general information, and then if you receive questions on it, you'll know what's there. If you do receive outreach from a school or from an IU, you know, you have a sense of what's going on. And there again, if you know, there's support that they would like to have, there again, not required support, but if there's support that they would like to have, and that's something that you're willing to support, that would be terrific. We're also developing contingency plans for a variety of things, such as power outages, such as vehicle accidents or disruptions between the hub and spoke for movement of vaccine, IT degradation, right? A variety of these things. So many of these things, you know, we will develop out the resources at the state level to be able to support, but many of these things, because of timeliness or we didn't contemplate it, or it's just not practical to support from the state level, you know, we'll want to work directly with the county emergency manager. So should something happen with regard to that site, that you know, we can continue operations there. So, you know, as we identify the sites and start working through some of these contingency plans, there again, you know, our planners and whatnot will be through, you know, in contact with the counties to just get a sense of you know, what the plan is, so everybody is aware of our contingencies and concerns. And that way, if something does come up and we need to reach out to the county, you guys have a good sense of what we're looking to do. And then lastly, are the critical information reports and essential elements of information. You know, there again, we're looking at it very similarly to what we're doing with vaccination sites, the election centers and stuff like that, that we really just want to make sure that anything that's going to impact one of these sites is up-channeled as soon as possible. So although we'll have folks there on the ground during operational hours, you know, during after hours especially, if it's a fire or a power outage or a potential security violation or something similar to that, you know, we'll want that brought into the CRCC as soon as possible, you know, so that we have a good understanding of it and can react to that and make sure that we can provide whatever we need to do to make sure that that site can stay up and running on the next business day. And this is just some of the CIR EEIs. And there again, this will all be on the hub, and once we get a lot more of the information finalized as we work through this week and the weekend, we'll get this all out to the county emergency managers so everyone has a good sense of what we're looking at. Okay. So I don't know if you had any closing remarks. Look to your Jeff.
No, it looks like there were some things that popped up in the chat real quick. This does not include Philadelphia. Since Philadelphia's vaccine allocation is separate, they have their own vaccine administration plan, obviously, and their own sequencing. There was another question that came up regarding prioritization. That is being worked out, and the way this kind of from a high-level perspective is, Department of Education had a fair amount of information regarding educators, support staff, private school staff, those types of things from each one of the IUs. So they took a look at the 94,600 doses and really carved out those doses based on the data that they had for the IUs. And this initial allotment or allocation is not going to cover everybody in the space up to third grade, but it will come very close to being able to do that. So there is a prioritization that Department of Education is working on with the IUs. There is going to be a scheduling process that is going to be utilized. The IUs are going to be involved with that, and they are going to work with our local education agencies and the school districts to schedule their personnel to be able to come into these clinics. Understanding that, there's going to be, certain time blocks for certain school districts and those types of things for the folks that fall into this. So that prioritization is being done at the IU and at the school district level, and the scheduling is being done at that level as well. And then we are providing working through AMI, which is the contractor in the National Guard, we are providing the support. Some of the IUs are probably going to require larger throughput clinics just because they have more people, and then some of them are going to be smaller, so they don't need the same amount of throughput. And we're working with the IUs right now to be able to determine size and space locations and those types of things. Some of them may be off-site of the IU depending on the situation and their capability to be able to support it with the infrastructure that they have currently. So we're continuing to work down through that process. Tim, did you touch on timeline at all?
Well, yeah, it was in the slide.
Okay,
10 to 13th, we'll start giving shots and be done by the 21st, 22nd. And then depends on how subsequent allocations come down. If we only get 10,000 vaccine week 2, then, Department of Health and PDE will work on stratifying the next group, and we'll give out 10,000. But if we get 100,000 in 2 weeks, then we'll do 100,000 within a similar time frame. So it just depends on vaccine allocation.
You may also hear information is going to come out. This J&J vaccine was also provided through the Retail Pharmacy Partnership Program, and Department of Health is working right now through that program to target that vaccine to child care services. So more information will come out regarding that. That's not kind of flowing through our agency at this point in time. We're really, working with Department of Education, Department of Health on the operationalization of this component of it. And really the goal is to try to get as many people vaccinated, following the stratification that the Department of Health and Department of Education laid out in the shortest amount of time possible. To be able to, realize the goal of at least getting the younger learners back into the classroom environment, or at least assisting in that process to the degree possible.
Okay. So as we had mentioned, the chat session, it doesn't appear there are a ton of questions. So we'll be able to respond back to those here in a fairly timely manner. We're also, there'll be an FAQ that's being developed that as soon as we have that available, we'll hang that on the hub and make sure folks have access for that. Otherwise, this session is recorded, and it'll be uploaded to the hub sometime later today. So with that, I hope everyone has a great day, and like I said, as we start getting additional information on site locations and making contact with the IUs on the specific sites, we'll also be in contact with the county emergency managers just to ensure you guys are in the loop, and if you do receive reach out from the IUs, you have a good sense of what's going on, and then also any contingency plans that we're looking at where we may look to the county to provide assistance for a contingency plan. We'll make you aware of that as well. So have a great day, folks, and talk to you soon.